Hi everyone, this is Dr. Tomar, and today I'm going to be talking about laser skin resurfacing. About 20 years ago, when we talked about laser skin resurfacing, it was more about the CO2 laser resurfacing. Now, although there were phenomenal results, there was a significant amount of downtime associated with it. So today the lasers are far more advanced and we don't experience the same kind of downtime, and the results are even better. So today I'm going to talk about the Fraxel Dual Laser. Now the Fraxel Dual Laser is actually two different lasers in one. It has the 1550 nanometer wavelength as well as the 1927 wavelength. So these two lasers work in conjunction with each other to treat some of the signs of sun damage as well as the aging. So the 1550 nanometer laser is the one that goes in deep. This is the laser that stimulates collagen and elastin in our skin after the treatment. It helps with fine lines, wrinkles, and overall improves the quality of your skin. It can also be used to treat acne scars because these scars are usually deeper in the skin. The 1927 laser, that is the more superficial laser. So what this is helping with is the sun damage in the skin. So as we get older, overall the quality of our skin changes over time. So you're going to have some of those sunspots and actinic keratoses or precancerous lesions develop. So the Fraxel laser addresses both the appearance of your skin and the health of your skin. So you develop fewer actinic keratoses over time, and you see improvements in the appearance of your skin by decreasing the fine lines, wrinkles, as well as getting rid of some of the sunspots or the age spots. So what Fraxel does is called fractional photothermolysis. A long name, what that really actually means is it creates focused areas of laser energy. Those focused areas of laser energy get denatured. And this is the area that's extruded by your skin over the course of 5 to 10 days after the treatment. As you get rid of this old skin, new skin is formed. And as the new skin forms, it doesn't have the same ailments as it did previously. This is brand new baby skin. So this is not going to have the age spots, the sun damage, the actinic keratoses. It's going to have the quality of healthy collagen. A lot of times patients ask me, does it matter what you use in terms of skincare before the laser treatment? So yes, it does matter what you do prior to your laser treatment. It's important to be on a good skincare regimen. If you provide the right growth factors, the right stimulus in conjunction with doing the laser, you'll have better results. So typically I would recommend the patients to be on a good skincare regimen at least 2 weeks prior to coming in. So they should minimize sun exposure, wear a sunblock when they're outside, and also start on products that have growth factors in it. So we use elastin skincare prior to starting the laser treatment. And also the new Cutest Bio Cream, that's an excellent product to use prior to starting the laser treatment. So what I typically tell the patients is come in with no makeup on. We will cleanse your skin and then we'll put some numbing cream on for you. That numbing cream is going to stay on for about anywhere from 40 minutes to 50 minutes. And after that, we're going to do the laser treatment. Now, just to show you exactly what the laser does and how it's used. So this is our laser head, and we put our little tip on it. So during the treatment, we're going to be doing brush stroke treatments, going back and forth, back and forth, back and forth. The entire area that is treated will be treated several times. Now we'll start out by doing one of the two technologies, whether the 1550 or the 1927, and depending on what the patient needs, we might do several passes of one, then followed by several passes of the other. Mostly what you'll experience is almost a feeling of a sunburn. There's some redness in the area and there's going to be some swelling. The redness and swelling usually dissipate within the course of a few hours after the treatment. You start on your skincare regimen immediately afterwards, and you minimize sun exposure for 2 weeks after the treatment as well. You can be out and about. We don't want you to be out at the beach for hours. As long as you wear a sunblock and a hat, you can be out and about. In terms of swelling after the laser, most patients experience swelling the day of the treatment and sometimes the morning after the treatment. We recommend that you keep your head a little bit elevated after the treatment. That minimizes the swelling for you. And patients who have had facelifts or eye surgeries may experience a little more swelling that may last a bit longer. But keep in mind, redness, swelling, it's all very temporary, goes away within a day to maybe up to 48 hours at the most. And you're going to experience roughness to your skin. Skin feels like it almost has a sandpaper texture to it for about a week. The reason you have that is the areas that were treated by the laser, they are little tiny microscopic scabs underneath the skin, and these are going to feel like they're rough in the area, they're going to be dry. So you can put makeup on as early as the next day, but typically the makeup is not going to go on nicely because your skin is going to feel dry. So there's a minimal social downtime, but you can do all your regular activities. You can go back to working out the next day. Occasionally, you might get little acne-like breakouts, but they're very temporary. Within a day or two, they subside as well. Sometimes patients have a little microdermabrasion treatment done about 10 to 14 days after the treatment that kind of expedites their healing process. So I also have patients ask me as to what areas can we treat with the Fraxel laser. The great thing with the Fraxel laser is it can be used anywhere on your body, wherever you're looking to improve the quality of your skin. So we have a lot of patients that treat face, neck, and décolleté. That seems to be one of our most popular area. And just because that is the area that's most sun exposed, tends to have a little more sun damage, and people are looking to improve that the most. We can treat all of those three areas at the same time. We also treat the arms as well as the legs. But keep in mind, as we go further away from the face, it takes a little bit longer to heal. It takes more number of treatments to get the results that you might want to achieve. So with the Fraxel laser, the number of treatments really varies based on the individual patient goals. If you're really looking to reverse the clock, you're going to need multiple treatments. If you're looking to stop the clock, you will need a treatment a year. So I typically recommend after the age of 30, you can do a Fraxel laser per year. Now, if you're looking to reverse the clock, you'll have to do it a little more frequently. So for patients who have more sun damage, they're slightly older, and they're looking to reverse some of the sun damage and turn the clock back, you can repeat it in as early as 6 weeks. I do recommend the patients to wait at least 6 weeks between the treatments so you really can see the benefits and your skin is fully healed from the first treatment before you do the second treatment. Once your skin is fully healed, you'll notice just the quality of your skin is going to change. You're going to have healthier skin and the pore size will look decreased. The brown spots will fade. You'll notice an immediate improvement in the quality and texture of your skin. In terms of fine lines and wrinkles, it is not an immediate result. You will notice a slow, steady stimulation of collagen over time that goes on for 6 to 8 weeks after the treatment. So that's why we recommend, if you're going to repeat the treatment, just wait till that 6 to 8 weeks point and then we can repeat the treatment for you. So I hope you have lots of information about the Fraxel laser resurfacing. If you have any further questions, give our office a call, or you can send us some questions. We'll be happy to answer them, and come in for a consultation to see what laser technology is best suited for the results that you're looking to have.